Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. I got a little rain going on in the background, so I apologize for the white noise version here, but definitely wanted to continue pushing out information for you. Today I wanted to talk about the 2 times income is a factor with regard to VA benefits. There's others, but this is the main 2, at least in my opinion. So when it comes to VA benefits, most things aren't going to have income requirements, at least most of the things that we actually care about, right? But there are 2 that are very significant, and they affect not only you as the veteran, but can also affect your surviving spouse. So I want to jump into that right now. Please hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. The 2 asks, hit the thumbs up, let the video run. If you want to support the channel in other ways, you can become a member. That's a way to support the channel. I truly appreciate it, and I do my best to get back to or acknowledge at least everybody's comments on the member side for sure. So you can do that. Go to the home page. You'll see highlighted members and a join button there. Thank you to all you members, subscribers, people who watch, thumbs up, all that good stuff. Thanks. All right, so let's jump into it. The 2 instances, in my opinion, that are the most important to realize, and again, please put in the comments any other ideas that you have out there as far as times where income is a factor that you think need to be talked about. The 2 that I like to talk about are entry into the VA healthcare system, and I'm going to talk about that because that's a kind of a weird, nuanced thing, the VA healthcare system. And the other is VA pension for veterans and for surviving spouses, right? So I guess it's kind of 3, but really it's 2, but one of them has kind of a fold in there. So the first one, the healthcare. When you think about VA healthcare, there are, I like to call it, roads into VA healthcare. You can't just automatically assume that you can go get healthcare, right? You have to have a qualifier. You have to be eligible for VA healthcare. Not every veteran is out the gate. Now, the primary roadway into VA healthcare is service connection for a disability, for a service-connected disability. You're rated with the VA on the compensation side. Even if it's one ailment that you're rated for, that gets your foot in the door with VA healthcare. Now it's at a lower level, and everything for that one condition is free. After that, you have to pay a little bit out of pocket, so forth. Once you move up in the scales on your rating side, well, then everything is kind of, it's carte blanche, man. Everything is free on the VA side for everything that you want to get done, especially if you're at the 100% realm. So then you're looking at dental and vision and all that stuff. Well, vision's at a lower level, but still, you get the point. However, even though that's the main driver into the healthcare system, there are other ways into the healthcare system. You do not need to be rated with the VA for any conditions. And one of those ways, there's a whole host, and I've already done videos on this, and I'll do another one again in the future of all the different ways to get into the VA healthcare system. This is specifically talking about when money is a factor. And it becomes a factor if the roadway into the healthcare system for you is means tested, meaning that it's income based, right? So you have to be a low, I like to say low or no income veteran, okay? So if you are low or no income, you could go get VA healthcare. Now, how does the money come into play? I don't know how much it changes, but you can go on to the VA's website, and there's a spot, and I'll try to remember to put the link in the description and the comments, where you can check the income limits for VA healthcare, and what it requires you to do is plug in a zip code and how many dependents you have, spouse and children under the age of 18. Then you hit next, and it takes you to a page where it gives you breakdowns on the dollar figures. So for an example, I plugged in Houston, Texas. So Houston, Texas, zip code with 1 dependent. So we'll call that a spouse, okay? Or maybe it's just a child, whatever the case is. So 1 dependent. So veteran with 1 dependent. And it pops out here, 1, 2, 3, 4, 5 different dollar amount ranges, and with little plus signs so you can open them up and then read. So I'm going to go from high to low. So $65,616 or more for a veteran with one dependent is the one I'm going to click on first. It says you may not be eligible for VA healthcare based on your income. But then it goes on to talk about you still might be able to get different various types of care through different means, different roadways into the healthcare system. Maybe go get service connected, or maybe you're a wartime veteran, a combat veteran, and you need mental health care, that type of stuff. So it gives you some options there. I'm not going to read through it all because I'm just really trying to focus in on where it kind of matters, right? And the bigger picture of it all. The next range is 59,000, and I'm just going to round these off, 59,000 to 65,000. And it says, here's what you may be eligible for. VA healthcare with co-pays for most types of care, like primary care, outpatient specialty care, and inpatient hospital care. Prescription medicines with co-pays. It also gives you an area in which you can apply for that benefit, the healthcare benefit, right online. And that's the VA Form 10-10. All right, so the next dollar range is $49,000 to $59,000. And it says, here's what you might be eligible for. VA healthcare with co-pays for most types of care, like primary care, outpatient specialty care, and reduced co-pays for inpatient hospital care. Prescription medicines with co-pays. The next one here is $21,000 to $49,000. So again, I'm going in descending order. It says, here's what you might be eligible for. Free. So if you make under $49,349, but more than $21,675, veteran with a spouse or one dependent, veteran with one dependent, those dollar amounts would go up the more dependents you have, I'm assuming. It says here, here's what you might be eligible for. Free VA health care for most types of care, like primary, outpatient specialty care, inpatient hospital care, prescription medicines with co-pays. That's pretty fantastic. So let's move on here. The last one is $21,674 or less. Here's what you might be eligible for. Free VA health care for most types of care. That's outpatient, primary care, outpatient specialty care, and inpatient hospital care. Free prescription medicines, travel reimbursement as well, which is fantastic. So that's what you're looking at on the VA healthcare side, income limits for 2024. Now for pension is a different beast, okay? Typically people who are looking for VA pension, and I apologize for the rain, people that are looking for VA pension don't really qualify for very much in the realm of disability compensation. So you can shift over to VA pension potentially if you are low or no income. This is an income-based benefit. You have to be low or no income in order to receive it. I like to call it a safety net program for veterans and surviving spouses. So if you're the surviving spouse of a veteran who had passed away, you may be eligible. One of the biggest eligibility requirements, and again, this isn't going to be a pension specific video, it's more of an awareness video. And again, I've done them in the past on pension and I'll do them in the future. This is mostly awareness, right? So for the biggest kind of qualifier is you must be a war period veteran. You don't need to have served combat. You don't need to be a combat veteran. You just need to serve during a war period 1 day during a war period. So that's an important factor. So there's some blocks of time there where veterans are not eligible for this simply based on that. And by default, their spouses are not eligible because of that. Now, let's jump into this. Again, it's low and no income. If you are a veteran, and again, this is for 2024, it started December 1st, 2023, so it's really the 2024 numbers with the 3.2% COLA increase to the dollar figure. So this is affected by COLA, and will go up every year if COLA goes up. So it mirrors Social Security increases. So if you have no dependents, and you don't qualify for housebound or aid and attendance benefits, your total maximum allowable pension rate is $16,551. What that means is if you make $0, if you have zero income, no Social Security, nothing, $0 coming into you, the maximum they will pay you out is $16,551 per month. Tax, or not per month, I wish per month, per year. $16,551 per year is the maximum amount that they will pay you. If you qualify for housebound benefits, that gets bumped up to $20,226 per year. And then lastly is if you qualify for aid and attendance benefits, they'll bump it up substantially to $27,609 per month. Or why do I keep saying that? Dreaming. I'm in dreamland. $27,609 per year if you qualify for aid and attendance benefits. And if you qualify for pension, that is another roadway into VA healthcare. But if you qualify for healthcare, it doesn't necessarily mean that you qualify for pension, even if you qualify income-wise. The reason why is that wartime piece, right? So you could be a non-war period veteran, low or no income, qualifying for healthcare, but not qualifying for pension. You can be a war period veteran serving 1 day during a war period and qualify for pension and have the roadway into healthcare. It's important to understand. So, moving on, here it says there's a notation. If you have medical expenses, you may deduct only the amount that's above 5% of your maximum allowable pension rate, amount $827 for a veteran with no spouse or child. So that's just part of the way that they calculate your income. So if you did have income coming in, you can bring that income down by deducting some medical expenses. Now, what I want to do, and I'll give you an example here in a minute, but I want to give you one more dollar figure set based on if you had one dependent. So if you don't qualify for housebound or aid and attendance and you have one dependent, your maximum allowable, again, this is if you make $0, you would get $21,674 per year. If you qualify for housebound benefits, you'd get $25,348 per year. If you qualify for aid and attendance, you would get $32,729 per year. So important to understand that. Let's read through these notes here. If you have more than one dependent, add $2,831 to your maximum allowable pension rate amount for each additional dependent. If you have a child who works, you may exclude their wages up to $14,600. My assumption here is that that child lives with you and is working, so they're in the same household as you. If you have medical expenses, you may deduct only the amount that's above the 5% of your maximum allowable pension rate amount of $1,083 for a veteran with one dependent. All right, so here's how it kind of works as far as, I'll give just kind of a quick down and dirty example. We'll just use easy numbers. Let's say that your maximum allowable pension rate is $25,000 because you have one dependent and you have housebound. Okay, so you get $25,000 annually. However, you are receiving $10,000 from Social Security. Okay, and let's say that you have nothing that you can deduct. There's no, just to keep the numbers clean. So you have $25,000 maximum allowable pension rate, but you're receiving $10,000 from Social Security. What will happen will be the $25,000 is reduced by $10,000 Social Security benefit, leaving you with $15,000 that the VA would pay you out annually on a monthly basis. So the maximum would then be $15,000 per year paid out on a monthly basis. And I think the big takeaway here is typically if you are receiving VA pension, times are tight. If you don't have VA health care and you qualify for VA pension, make sure you go get VA health care to save money on that aspect as well. The other piece is surviving spouses qualify for VA pension if they are low or no income. The same kind of rules apply. So please make sure that this information gets around, because this is an important benefit for all of us. Thank you so much for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.